On everybody, I am taking a minute here to provide a COVID-19 update after Mr. Personality himself just spent a little time talking to us on what's taking place. I thought that maybe perhaps I would get on and offer a different opinion, because at the end of the day, guys, that's all it is an opinion. And it's an opinion from someone who might not be the sharpest tool in the shed. Now, why do I say that? Well, I say that because a long time ago, everyone, and I'm waiting to see people start popping up in the comments. Where's everybody at? I know Captain Energy just finished or is about to finish, but let's have a discussion here about what's really taking place in the state. And one of the things I wanted to share with everybody here is comparing Europe to the US, the evidence is clear: lockdowns don't work. And why I wanted to share this with everybody is because once again, our governor just went on television and told us all about this crazy pandemic, the coronavirus that's, going to do all this damage and death across the country. And it has, right? It has created, a ton of pain and panic and pandemonium and everything else. But the problem is we don't really know how many deaths there have been from the coronavirus. And now, every single day, another study comes out that, guess what? They screwed up again. So I wanted to talk about this, comparing Europe to the United States on lockdowns, because our governor just came out, again, talking about mask wearing, talking about business closures, talking about the need to protect Nevadans. But at the end of the day, what's it all about, everybody? What did I tell you about almost 3 months ago? It's a power move. It is one thing, you'll never see happen, is the opportunity to use a crisis to their advantage. And Governor Sisolak is doing just that. So here's an interesting thing, though. So like they said in Europe, here's the good news for opponents of lockdowns and mask mandates: they don't work. However, that is also the bad news, because they don't work. Politicians who have seized power by executive fiat for months on end continue promulgating even more life-altering rules, precisely because the original ones never worked. So that's what we're doing. Every day we're getting on and we're talking about the increase in positive cases and the need for more draconian lockdown measures. But at the end of the day, if they've never worked, why are we going to continue them? So here's the easiest part. Americans are now facing this predicament. The more effectiveness of these executive policies is the more the effectiveness of these executive policies is disproven, the more the politicians use that lack of results as a pretext for even more rules. Thus, if the stay-at-home orders failed to work as promised, they demand mask wearing. If mask wearing was in place for months and still didn't work, which has been the case in most of the hot spots, then they mandate mask wearing in personal homes in Broward County, Florida, and for 2-year-olds in Baltimore County, Maryland, because the only possible explanation for continued spread of a virus that's not deadly for most people is that 2-year-olds weren't wearing masks. God dang, isn't that it? Particularly young kids. Oh, this was what I was going to say. Never mind studies from nearly every major European country showing kids, particularly young age kids, do not contribute to community spread, even if masks did work. Wow, that's a big one, guys. So again, I find it odd that videos that were getting 15,000 views are now only getting 2,500 and 3,000 views. Must not be that the information's any different. Must be that we're getting hidden again. So here is it. Speaking of European countries, it's time to dispel one of the more popular myths propagated by our new dictators. We are constantly being lectured to by the experts that America didn't have enough of a lockdown, and that's the reason why we are still seeing the spread of the virus. Well, Europe seems to be done with it. A new eye-opening analysis from the American Institute for Economic Research shows that America had just as severe as the lockdown as most European countries, and in fact had a longer lasting lockdown than every other country except England. Wow. The accusation that America did not lock down enough is based on three premises: that we locked down later than Europe, didn't lock down as hard, and reopened earlier. As Philip Magnus of AIER says, that's the Economic Research, American Institute for Economic Research, as Philip Magnus of AIER proves using the University of Oxford's stringency index of lockdowns, all three are untrue. Using a scale of 1 to 100, Oxford researchers gave 1 point to each country for a list of 17 policies that they implemented during the epidemic and tracked aggregate score over time. So, all I can share with you is that of these countries, almost all imposed their most stringent policies exactly the same time. The week surrounding March 16th release of Imperial College Report, which also corresponded with the World Health Organization's pandemic declaration on March 11th, only Italy, an early hotspot, preceded this wave of lockdowns, having imposed them in late February. Thus, America started when everyone else did, except for Italy, and achieved essentially the same lockdown score within a week. But here's the real kicker. The myth of the Great American Reopening: not only did the reopening in most places in the U.S. not begin before most European countries, but the reopening in Europe has been much more encompassing to this very day. As of July 4th, even with slow reopenings underway in most states, the stringency index shows that the United States, 68.89, as a whole still remained under heavier restrictions than any country in Western Europe except for the comparatively shuttered United Kingdom. Hence, after causing so much collateral damage, lockdowns don't even work to stop the spread. America is locked down and has been this entire time. Take Switzerland, for example. It opened much earlier than the US and now is at a 36.57 index, almost half of the United States. Wow. Then, of course, there's Sweden, which never achieved more than a 46 index. The results: Sweden is essentially done with the virus. Even a few states that opened up early in late April or early May are clearly not responsible for the spread because the virus did not spread during the key weeks following the reopening. The timing of the spread in southern states is much more in line with the rioting and protests, which would explain why we had a resurgence that Europe thus far has not seen on such a large scale. So Dr. Fauci, you wouldn't admit it on TV the other morning because you're a coward, but you can say it. Say it with me. The protests and the insanity in the streets with the rioting has absolutely created a problem with the resurgence of coronavirus in the United States. You could say it, Dr. Fauci, just like I just said it. If you've got thousands and thousands of people protesting in the streets without masks, spitting all over each other, organizing, screaming, yelling, and touching each other, it's probably going to be an increase in COVID tests. Right? I mean, Dr. Fauci, if you can't say that, then I'm sorry, my friend, you should be fired. Now, the most controversial debate: masks. Story at a glance. Science clearly shows face coverings of various kinds do little, if anything, to prevent respiratory illness caused by our aerosolized viruses. Influenza viruses, coronaviruses that cause the common cold, and SARS coronaviruses all spread via the air, not just via droplets or touching contaminated surfaces. Preventing droplet contamination does not mean you also prevent the transmission of the aerosolized virus. SARS coronavirus is a beta coronavirus with a diameter of between 60 nanometers and 140 nanometers, or 0.06 to 0.14 micrometers. Virus-laden saliva or respiratory droplets expelled when talking or coughing measure between 5 and 10 microns. Okay, regardless of the mask, it will not prevent you from exhaling or inhaling the aerosolized virus. But cloth masks are clearly the least preferable option if you actually want to reduce the spread of infection, as their ability to block respiratory droplets is also severely limited. Okay, so what does that mean? That means, as once again, masks do not likely inhibit the viral spread. Story at a glance. Not a single randomized controlled study controlled trial with verified outcome has been able to detect a statistically significant advantage of wearing a mask versus not wearing a mask when it comes to preventing infectious viral illness. Right there. Story at a glance. Not a single randomized controlled trial with verified outcome. Now, all you doctors out there that can't take anything without a randomized controlled study, there's your study, and it says that masks do not work. If there were any significant advantage to wearing a mask to reduce infection risk to either the wearer or others in the vicinity, then it would have been detected in at least one of these trials, yet there's no such sign of a benefit. There is no evidence that masks of any utility, there is no evidence that masks are of any utility for preventing infection by either stopping the aerosol particles from coming out or from going in. You're not helping the people around you by wearing a mask, and you're not helping yourself avoid the disease by wearing a mask. This is from Dr. Joseph Mercola. It is a health site. This is from a doctor, and it is using real randomized controlled trials. Not working. Governor Sisolak, the masks don't work. The masks don't stop the spread. The ridiculous business closures that were supposed to be for 15 days don't stop the spread. It's time to open the state up 100%, open our schools up 100%, and stop the nonsense. And get our athletics back on the field and get our athletes back in their sports now, because what you're doing is criminal and it's unconscionable. Now, going to this Illinois review, I thought this was funny. This is from Dr. Scott Barber, MD, examines the hoaxes surrounding COVID-19. Number one hoax, the efficacy of masks. Do you guys see that there? Now, Governor Sisolak. Before the outbreak, the consensus literature was exactly what Dr. Fauci said it was originally. There did not appear to be any studies that demonstrated the efficacy of masks in the transmission of what we call influenza-like illness, which are the types of viruses that spread in respiratory droplets and cause respiratory illness. Why now are the masks being mandated? The Center for Disease Control changed its own mask recommendations regarding influenza-like illnesses after the coronavirus outbreak. Wow, that's weird. When the pandemic first made its appearance, the CDC basically stated that masks have not been shown to be effective at preventing the transmission of influenza-like viruses. Now the CDC recommends mask wearing. What changed? So I will say this, I'm absolutely fine with mandating masks for people in their private home or business, but I also, like this good doctor, believe that there's no need for the government to be mandating masks, that we wear masks when the data is unclear whether masks prevent the transmission of the virus. But the psychological aspect of making us wear masks is to keep in the forefront of our minds that we are in deadly danger from the coronavirus, making it easy for us to be influenced into more lockdowns and more draconian measures. Wow, that does sound sure a lot like what's going on. The whole point of lockdowns came from the movie Contagion. Lockdowns have no basis in science and were done despite some economists warning about the negative effects on the economy. The lockdowns have continued because of faulty information. So Governor Sisolak keeps getting up and providing Nevadans with faulty information. The masks do not work. The lockdowns do not work. They do not slow the spread. And just to share with you guys why this is true, well, initially, the idea of lockdowns was to flatten the curve so hospitals wouldn't be so overwhelmed with an influx of Corona-19 cases. Lockdowns were never meant to stop the transmission of the virus. This is not possible. A supermajority of patients are asymptomatic. These people are out in the population. So the virus is going to spread throughout our country just as viruses typically do. Nothing we do will put the genie back in the bottle again. God. And this is a doctor. This is science. This is controlled studies. Wow. So it was never about to slow the spread, was it, Governor? It was about the special session. It was about the mail-in ballots. It was about the ballot harvesting. Okay. Just wanted to be clear. Here we go. As to reporting, CDC reported in May 2020 that 60,000 people would die. After 1 weekend, the figure dropped to 30,000. How is that possible? When coming in from behind, trying to justify the lowering of deaths by half, defenders of the CDC claimed the numbers were somehow misunderstood. However, the 60,000 number of deaths had already accomplished its purpose, that of maintaining the lockdowns. As for the CDC, claimed it was an accidental conflation of the numbers. All people who had already been exposed to the disease, a supermajority of patients who didn't even know they were sick, were combined with those who were sick with the virus. This combined number was then presented on the news every day as the number of new coronavirus cases. And here's something else I'll share with you. Did you know that when you're being tested multiple times for coronavirus, be you in the hospital or a healthcare worker, did you know that they're counting those positive tests each and every time? Not for that person, but just as another positive test. Driving that number up as far as we can to scare the heck out of everybody. A fair question to ask is if the conflation of the numbers was really a mistake or politically motivated to drive up the numbers to make us hysterical and to repeat the lockdowns not based on science. Evidence is clear. Lockdowns don't work. In America, the coronavirus continues to spread despite a much more severe lockdown in Sweden and a much longer lockdown than nearly every European country. Wow. So now, where does that leave us? Well, I'm not going to talk about the medication that's out there that's saving lives all over the world, that saved tens of thousands of lives, because apparently we're not allowed to talk about hydroxychloroquine. But what I do want to mention here under hoax number 3, using HC to treat COVID, on July 27th, Harvey Risch, a professor of epidemiology at Yale School of Public Health, says that hydroxychloroquine is the key to defeating COVID-19 in a Newsweek op-ed published this past week. Scrubbed from social media because frontline doctors dared to tell of the coronavirus cure properties of hydroxychloroquine. And number 3, Fauci crosses President Trump over hydroxychloroquine and its ability to fight and treat patients with COVID. Now, I want you guys to know that back in April, Dr. Fauci was on a radio station in Philadelphia where, when asked by the radio station disc jockey if he had a patient with coronavirus, would he treat that patient with hydroxychloroquine? And Dr. Fauci said, absolutely. Okay? So for someone to suddenly do a 180 spin, I don't know about that. Now, we had hoax number 3. Hoax number 4 was HC first deemed ineffective, then it was killing people. And he says that the New England Journal of Medicine and Lancet, both prestigious medical journals, came out with a study calling HC unsafe and ineffective. When asked for verification of the data, there was none. So journalists had to retract their stories. It's notable that the false study used by the medical journals was produced by Zenosphere, a company that no longer exists. Even though the journal articles were proved false, they provided the FDA with the excuse needed to ban the use of HC with zinc in the middle of a pandemic. Also prevented were further studies on the use of HC, that's hydroxychloroquine. This resulted in many community doctors no longer prescribing HC for their patients, especially when the media falsely accused HDC of further killing people, which never happened. The FDA decision was viewed as favorable outcome for those to seek to keep the lockdown in place. Said Dr. Barber, the FDA doesn't have the power to tell a doctor when to use medication. Doctors use 40 to 60% of all medications off-label. I'm going to say that one more time for you people like to jump in my comments and say ridiculous nonsense about hydroxychloroquine killing people or causing heart problems. The FDA doesn't have the power to tell a doctor when to use a medication. Doctors use 40 to 60% of all medications off-label. Barbara questioned why Trump isn't making hydroxychloroquine an over-the-counter medication so patients can make their own decisions like free people. It has a 65-year track record for safety, especially when we don't have lots of good options at the present time. And again, as I've said to everybody this entire time, no one is saying you have to use this medication. No one's forcing you to use this medication. No one's telling you have to use this medication. But we are saying that where it has results in the 90 to 95% rating of efficacy, that we should probably allow people to use this if they want to, right? My body, my choice. My body, my right. Finally, this is a real one. Number 5, hoaxes, fudging the number of deaths. Early on until recently, a majority of deaths recorded in the media were in New York, New Mexico, Pennsylvania, California. Fewer deaths were recorded in Texas, Florida, and Arizona. It was unthinkable to Trump's opponents that blue states with lockdowns and masks were doing worse than red states with no masks or lockdowns. The predictable happened. There was a spike in red state deaths. Worldmeter evaluates number of deaths in every country, new cases, and discharge of people who get better for the U.S. Doctors, including Barbara, observed how these numbers presented on Worldmeter were starting to get fudged. Crazy graphs depicted the flattening of the curve in blue states, evidence that deaths were decreasing, but a big increase of deaths in red states. Convenient for those who wanted lockdowns to continue. Clarification came from John Sullivan with his article on Just the News website. It set forth the following. On July 7th, Arizona reported a new record number of new deaths. Hold on. Number of new deaths of 117 new deaths. What the news media failed to report was that most of those deaths were deaths that occurred much earlier, but had just been logged that day. The real number of deaths was 53. The record number of Arizona deaths had been recorded on June 30th, before the July 7th mandate for lockdown and face masks. Sullivan's report also stated facts about Florida's death count. Reported by the media was that Florida experienced the single most deaths on July 15th, 156 deaths, when the actual number was 58. Sullivan called and tried to find out what was going on, but was told it was just a computer glitch. It has gotten to the point where numbers are completely untrustworthy and difficult to evaluate. CDC has already admitted combining patients who have the virus with those who tested positive for antibodies but didn't have the virus. As a famous motorcycle case demonstrated, coronavirus was diagnosed as the cause of death instead of the motorcycle accident itself. Countless labs have reported 100% positivity rate, which means every single person tested positive. That was actually in Florida, where they found a 98% positivity rating, which was later found to be a mistake, and it was actually 9.8. 98 and 9.8 are a huge difference. Okay, now, finally, coronavirus is overwhelming hospitals. This is the big one. Ladies and gentlemen, everyone's telling you to do your part, protect your community, wear your mask, save a life. All nonsense, all complete BS. Here's the most important part. A narrative being promoted by the media is the overwhelming of hospitals because of surge of COVID-19 patients. This is happening at a time when many hospitals have had to lay off workers. Many have gone out of business, and some have suffered financially. It's a combination of decreased hospital staff and people coming back for surgeries put off by several months that is creating the illusion of overwhelming the healthcare system. Said Barber, it's difficult to evaluate the level of new coronavirus threat because the numbers are so impossible to evaluate. There is one statistical manipulation after another to keep us afraid and believing that the pandemic is out of control and the lockdowns must continue. All right, guys. So again, all I wanted to share with you was that the United States lockdown did not work. The mask did not work. The insane business closures are not working. And the most important part to all of this is, even in Florida now, they're saying COVID-19 increases in Florida do not justify broad shutdown and closing schools. Here we go again, guys. The closing of the schools. Here's the most important part. Often left out of media reports on the COVID-19 surge is a discussion of the demographics of who's getting the disease. The median age of those infected in the state has plummeted to about 38, down from over 50 in April. Given that about 84% of Florida's COVID deaths have come among those aged 65 and over, and nursing homes account for roughly half of those deaths, this age change is a positive sign. Not all COVID cases are created equal, and increased infections among the young and healthy should not be treated the same as if they came among elderly and vulnerable. In fact, the higher the share of relatively resilient young people who get sick, the more herd immunity is built up to protect seniors and those with pre-existing conditions. I'm going to say that one more time. In fact, the higher the share of relatively resilient young people who get sick, the more herd immunity is built up to protect seniors and those with pre-existing conditions. That means send our kids back to school this fall without any ridiculous measures or masks. Okay? That's what this says. Why does it say that? A greater share of young people getting infected is partly responsible for the fall of the COVID death rate, which the Center for Disease Control recently estimated to be just 0.04%. Excuse me, 0.4%, not 0.04, 0.4%. That's roughly an order of magnitude lower than the original estimates used to justify the stay-at-home orders. Guys, that's kind of a big deal. The current death rate is estimated to be 0.4%. That's roughly an order of magnitude lower than the original estimates used to justify the stay-at-home orders. The disproportionate impact that COVID has on the most vulnerable is a tragedy, but it neither justifies another broad shutdown nor the closing of schools. Wow. The best medical evidence. Did you hear that? Governor Sisolak. Let me repeat it louder, because maybe you're just not hearing me. The best medical evidence suggests that schools can reopen for in-person instruction as normal at the end of summer. Children do not seem to be affected by the disease much, if at all. Adolescents also face an extremely low risk. Far more minors die from the flu than from COVID. Joey, why are you screaming? I'm sorry, guys. I don't know. I just think that Mr. Energy and Mr. Personality himself, Governor Sisolak, can't hear me. Because if he could hear me, why would he continue with this ridiculous nonsense? He wouldn't, right? He wouldn't. Because, again, the best medical evidence suggests that schools can reopen in the fall for in-person instruction as normal. Wow. A growing body of evidence also finds that kids don't transmit the disease. A recent study out of Germany concludes that schools didn't increase virus prevalence. A study from the Netherlands finds that transmission among children or from children to adults is uncommon. Empirically, COVID cases did not rise in Europe after schools reopened there in the spring. Wow. But I think the most incredible thing I've read yet, there is not a documented transmission of student to teacher transmission of COVID-19 in the world. One more time. There is not a documented transmission between student and teacher in the world as it applies to COVID-19. Why is it so important for kids to go to school? Well, school is vital for children's scholastic and social development. More than half of all students rely on their schools for food. Virtual schooling has been a disaster. Okay, are you ready to hear this? Virtual schooling has been a disaster with disproportionately bad outcomes for minorities who have less access to broadband. As a result, the American Academy of Pediatrics strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school. Governor Sisolak, every time you get up for one of these ridiculous little updates, you get up there and you talk about the evidence, you talk about the science, you talk about the data, you talk about the medical evidence. This right here says that the best medical evidence suggests that schools can reopen for in-person instruction as normal at the end of summer. Okay? Governor Sisolak, again, my friend, it once again states that closing the schools will have a disproportionately bad outcome for minorities and those who have less access to broadband and other resources. You are leaving our children behind. By doing this ridiculous business closure, lockdown, and school closures, you are leaving our children behind. Now, I want to say this. Keeping schools closed also delays the state's economic recovery because parents need to stay home to look after their kids. As with a broad economic shutdown, not being able to go back to work because of childcare responsibilities contributes to sky-high unemployment, broken business streams, and worsening mental health. God. Meanwhile, booze sales are booming, and domestic abuse activists in the state fear an explosive cocktail. Wow. The mental health impact of the disease and societal shutdowns will reverberate for years to come. Rising COVID-19 cases, hospitalizations, and deaths, oh man, in the Sunshine State and elsewhere are worrisome and necessitate tailored interventions to protect the most vulnerable, but on closer inspection, they do not require another broad shutdown or school closures, which are worse than the disease. Oh man, I don't even know what to say anymore, guys, because in just one document, and again, you guys can go on The Capitalist or go on Maricola.com right here up at the top, and you can look on this. But again, guys, the best medical evidence suggests that schools can reopen for in-person instruction as normal at the end of summer. And the American Academy of Pediatrics strongly advocates that all policy considerations for the coming school year should start with a goal of having students physically present in school. And I want to say this, guys. I had my niece home for the end of the school year, my goddaughter, Carmela Grace Green. She was here at our house finishing school. She was trying to do the distance learning. It was a disaster. Her math was a disaster. I couldn't even do her math. It was such a disaster. I had to reach out to my boy at the College of Science and bring in a UNR math tutor in to teach my daughter and my niece, and no problem. I got the resources. I got the ability. I got the skills, right? I can do that. But if we're going to listen to the best medical evidence and from the American Academy of Pediatrics, they will say that school is vital for children's scholastic and social development, and more than half of the students rely on school for food, and virtual schooling has been a disaster with disproportionately bad outcomes for minorities who have less access to broadband. That's it. That's it. That should be a wrap right there. At the end of the day, if you really want the best medical evidence and the lockdowns and the mask wearing, and open the schools and let everybody get back to normal. And finally, I will end with one more thing on the masks, because I mean, the masks have been so ridiculous. Here we go. Aerosolized viruses. That's what we're called. Aerosolized viruses. Masks cannot block aerosolized viruses. Read that. You see that? So what does that mean? It just means the virus is not restricted to respiratory droplets, though it is also in the air itself, and these aerosol-sized particles are far tinier. To block these, you need a mask that prevents all airflow. And that, of course, wouldn't work since you need airflow to survive. There is little evidence regarding the transmission of small aerosol-sized particulates of the size potentially exhaled by asymptomatic or pre-symptomatic individual with COVID-19. Again, guys, this just means that the mask can't stop the virus. Everybody knows this. In a healthcare setting, they work. In normal life, touching your face every 5 seconds doesn't work. Here's one more. Taboo question. Are face masks spreading the coronavirus? Wow. As censorship intensifies with a doctor's press conference largely scrubbed from the internet because the physicians reject the establishment narrative, there's another important question now being asked only in Web Siberia. Could face masks be spreading the Wuhan virus? This was posed today by ex-Army surgical technician and biologist J.H. Capron. Capron, a man trained in face mask hygiene and sterile technique, strongly suspects that masks, when worn by the general population, become vectors for COVID-19. What does that mean? Building his case, Capron projects the theory that poor mask hygiene during the Spanish flu epidemic in 1918 and 1919 made the face coverings fomites, objects capable of harboring and transmitting pathogens that actually spread the disease. He then laments how people today don't appear to understand the microscopic world any better than our World War II or World War I era forebears. Note that months ago, Dr. Anthony Fauci, whose schizophrenic virus pronouncements instantly go viral and become articles of faith for the faithless, also stated that masks worn by the general public are ineffective and pose the self-contamination problem. He later claimed that he was lying because masks were in short supply. Putting flip-flop Fauci aside and accepting that a quality mask properly maintained and worn by a vulnerable individual may reduce his disease contraction probability, Capron addresses something overlooked. It's something often overlooked, in fact, in many spheres of analysis, theory versus practice. In theory, Marxism appears to work until you factor in how real human beings actually behave. So now, let me just say this, guys. All this doctor really talks about, if I go through the whole thing, is talks about touching your face. The moisture, the wet vector that's now becoming contaminated. These masks are thrown in your pocket, your purse, wherever, the front seat of your car like mine is, and then you put it back on. So again, all I want to say to everybody, go look up this article, okay? Look up, do some research on whether or not masks are in fact spreading the coronavirus. And so as I always do, guys, I try to bring it to you real. I try to bring it to you with a little bit of enthusiasm and some mojo, right? Some charm. But at the end of the day, there is no more of a need to remain locked down and wearing masks as there is for anything else. Okay? The masks don't work, the lockdowns don't work, and the ridiculous business closures need to stop. So, once again, this is Joey Gilbert with an update on why the coronavirus has now become essentially a political football, and it is being used now in the state of Nevada to usher in mail-in voting, which we all know has an incredible propensity for fraud, and to keep us locked down and at home, damage this state so we can implement new taxes. That's what we're doing. So again, Nevada, fight back, stand up. Share this video, like this video. If you need any help with anything dealing with COVID, media@joeygilbertlaw.com. Again, media@joeygilbertlaw.com. And if you need access to meds, we have doctors who will gladly speak with you and make sure you get the proper medication you and your family need. Don't buy into the BS. Don't buy into the nonsense. Again, wear a mask if you're in a closed space. Wear a mask if you're in a business that requires you to wear a mask. But if you're not in a place that requires a mask, get that damn thing off. Take in this deep, this beautiful summer Nevada air. Get up to the lake. Get your vitamin D. Get your vitamin D, people. Let me tell you something. I just read another article. I want to say that. New York doctors highlight the importance of vitamin D. I forgot this. I want to say this. Get on your vitamin D. Okay? I want to say this as I close. Our immune systems can fight this. Vitamin C, zinc, vitamin D. Get on it. Up your water intake. Get out in the sun. Get on the trails. Get that mask off. Eat healthy. And again, don't buy into this BS. It is not necessary. Open our schools on time. Put our sports back on the field. Let's go.